If you get Medicare wrong, it's not just a small mistake. It can cost you thousands of dollars, and in some cases, you're stuck with it for life. My name is Wendy. I'm an independent insurance broker, and I focus primarily on helping Medicare recipients and people preparing for retirement. And I can tell you from experience, most people don't make these mistakes because they're careless. They make it because nobody explains it clearly. So let's fix that. Enrolling at the wrong time. This is where lifetime penalties can show up. A lot of people assume Medicare starts automatically or they can pick it up whenever they want. That is not how it works. And if you miss your timing for Part B or Part D, you can face lifetime penalties. I've worked with people currently who pay much higher premiums for Part B and Part D because nobody explained their enrollment timelines properly. And that's just mistake number one. Mistake number two is choosing a plan without checking your networks with the doctors that you currently see and not checking how or if your plan will cover your prescriptions. So people often will pick a plan based on a commercial they see, or they might pick a plan based on a family member's option, or they might hear a neighbor or friend or maybe a fellow church member talk about how great their plan is working for them and arbitrarily enroll into that same plan based on the experience of someone else. And when they do that, they don't check doctor networks, they don't check medication coverages, and then suddenly when they begin to use their plan, they find out their doctor doesn't accept that particular plan, a specialist is out of network, or a medication isn't covered. And you do have an option to change plans, but only a couple of times a year, depending on which plan type you choose. Mistake number three is assuming Medicare covers everything. While I agree this should be true, it just isn't. Original Medicare, which is Parts A and B, collectively only cover about 80% of your healthcare costs, and the 20% gap is unlimited. The whole purpose of getting something in addition to Original Medicare, so that you aren't exposed to unlimited medical bills. There are a few options to cover that unlimited 20% gap. Of course, the first option is to pay for it, but most of us can't afford an unlimited 20% gap when it comes to our healthcare, especially the older we get. So the other option is if you qualify for Medicaid. Medicaid is a program for people with low income and limited resources. If you qualify for Medicaid in addition to Medicare, full Medicaid benefits would pick up the gaps in Original Medicare and also pay your Part B premium for you. The next option is called a Medicare Supplement or a Medigap plan. These are letter plans that are standardized by the federal government but issued by private insurance companies. Medigap plans or Medicare Supplement plans supplement Original Medicare. You may have some out-of-pocket expenses associated with that, depending upon which letter plan you choose. You would pay a monthly premium for whichever letter plan you choose to whichever company you choose to go with. That premium differs based on your age, gender, tobacco use, the company you pick, and where you live. The other option is called a Medicare Advantage prescription drug plan. Advantage plans actually offer your Parts A and B and D through private insurance companies. Those plans put a limit called a max out-of-pocket on that 20% gap in Original Medicare. Your financial responsibility is the maximum out-of-pocket each calendar year associated with whichever plan you choose to enroll in. Many of those plans are either zero premium or a very low premium, but you pay copays and coinsurance as you use your plan to the plan's maximum amount. In other words, if you went to a specialist, you would pay a flat copay. But if you receive Part B drugs through a facility, perhaps an infusion, chemotherapy, or dialysis, you would pay 20% coinsurance for each service up to the plan's limit. Each time you use your plan, so each time you receive healthcare service, you would receive a bill for either a copay or a coinsurance until you reach the max limit. Those plans will also offer additional benefits in a lot of cases, like dental, vision, and hearing. Medigap plans do not offer any additional coverages, so you have to grab what's called a Part D or a standalone drug plan to get drug coverages with a Medigap plan. Additionally, if you want dental, vision, or hearing, you would also have to get an individual policy if you chose a Medigap plan, because those services would not be covered under original Medicare. Medigap plans or Medicare Supplement plans will only pay their part of what original Medicare approves. You'll hear many opinions from healthcare providers all the way to even insurance agents as to which plan is best. And the truth is that the best plan is really just the plan that works best for you. I have clients who absolutely prefer to have the freedom and flexibility of original Medicare and a Medicare supplement. They add drug coverage, and they also add individual policies for dental, vision, and or hearing. I have other clients who prefer to only pay for their health care as they use their plan. They also understand, because I explained clearly, that Medicare Advantage plans do come with a higher rate of what's called prior authorizations. A prior authorization is something that is required for certain treatment and services that your physician has to submit to your insurance company prior to approval. They work very similarly to a group employer plan. So if you're working or have been working recently or have worked in the past and you have health insurance through work, you probably had either an HMO or a PPO. That's exactly how Medicare Advantage plans work. Some people like them, some people hate them. To me, this is not a one-size-fits-all. This is very specific to your circumstances, your medications, networks, preferences, and of course, budget. If you're entering into your eligibility for Medicare or maybe about to retire and you've delayed Medicare, please look closely at your plan options. Don't make assumptions when it comes to your healthcare plan. I always recommend have someone double check before you actually enroll into any plan. If you'd like my help, all of our services are completely free. You can either call the number on your screen or you can click the link in the description to schedule a consultation with me. We're located in Tulsa, Oklahoma, but licensed in multiple states. So if you don't feel like driving to the office or you live out of state and want a virtual appointment, we offer phone and virtual appointments as well. And of course, if you find this information valuable, don't forget to subscribe and like. We'll post content every single week. Thanks for watching.